frenectomy. Ectomy means to cut. So we don't cut, right? That would be outside of the occupational therapy scope of practice. So I called her back the next day and I said, can you say again what your doctor referred you for? And she said, yeah, a tongue tie release and a frenectomy. And I explained that ectomy means to cut that part of your body. Welcome to the Fascia-Informed Therapist podcast, designed for health and wellness practitioners interested in fascia science. I'm Amy Mayer, occupational therapist, practice owner, author, and educator with more than 30 years of experience using fascia techniques across many settings. Each episode brings practical insights and thought-provoking conversations to help you expand your skills and better serve your clients. Let's get started. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. Today, I want to share a story of something that happened with a potential client and share some other changes that are happening. It's June 1st, 2026, and June 2026 is going to be a big month for my private practice and for my online courses, and it's just... this is the year of the fire horse, and the horse is moving very, very quickly. So first of all, the two locations that I have in my practice, my private practice, Mayer Fascia Wellness, are both closing this month. The West location in Omaha was intended to close this month, and our lease at our main location was up in December, but we asked our landlord if we could move out early because we didn't want to move in the middle of winter. And he said, if I can find somebody to replace you, that would be great. And he's a good guy. So he was willing to start looking for somebody for us. And he called us up and said, well, when do you think the earliest you could move out would be? And we decided, first we thought August, and then we thought, why not June? We didn't go with July because there was some other big thing happening that month. And just a reminder too, I have to make these decisions in conjunction with we'll call her my business partner. We're two separate businesses co-leasing a location together. So whatever one decides, the other needs to be in agreement in terms of anything that has to do with the lease. So she had something big happening in July, and we decided, okay, well, why not June? Why not just, if we're going to move on, let's just move on. So we've both decided it's time to really dial back. She's 5 years older than me, and we both wanted to go back to one small single room for each of us. So she has her own at her own location, and I've leased a separate room at a different location, and I'm really excited about where I'm moving to. But the hard part is moving the locations that I have, two separate locations, and then our main location also has a big classroom. There's a second treatment room that we use between Caitlin and Maddie and myself, and it's like moving a 3-4 bedroom apartment down to a studio apartment. So getting rid of a lot of things. If you're on my Mayer Wellness newsletter, then you've seen all the things that we're getting rid of. And our clientele, people in the newsletter, have been amazing. And we've already gotten rid of a lot of items and feeling really good about being able to get this wrapped up by the end of June. So the other piece is the online aspect of my business, the courses that I have. And thank you so much to the people that have been in the courses and given me good feedback. And that's been wonderful. But I've been on a platform called Teachable for the last several years, and that was really the best available that I could find many years ago. Gosh, probably almost 5 years ago. Started with them and was able to really build some good courses on that site. But a few things have happened that made me want to change. And so I'm going over to, and I'm not an affiliate for them or anything, so I'm not getting any bonuses or kickbacks for promoting them, but I'm going over to a platform called Podia. And the cool thing about them, other than they're much less expensive, they have integration with email, so I don't have to have a separate email platform, and that's huge. The more things you can have in one place, the much easier it is to run your business and not try to make things that aren't related talk to each other. So I'm excited where that's going. There are several courses. The Teachable courses were migrated over this month, and everything had to be done by next week in order to not get charged another year on Teachable. So that has been a big process, migrating those courses over. They're over there on Podia now. I'm just going through them one at a time to make sure that everything looks good and migrated over appropriately. And I'm kind of updating some of the courses as I go as well. So if you were on Teachable and you were a student and you had a product over there, then you've been automatically enrolled in that course on the new platforms, and you will get an email saying so, and instructions on what to do to get back in that course if you want to. So, or just go there and check out. I have a bunch of new things, and I'll talk about that in another podcast. But anyway, let's get to the story. Okay, so there's been a big rush in our practice on new clients calling and wanting to get in to be seen, and I don't know if it's just a random act or if it's maybe has to do with the New York Times article that came out about fascia. I've had so many people send me that article and say, "Hey, have you seen this?" And yes, I have, and it was well done, and it's drawing attention to fascia, and more people are going to be looking for help. So if you're in the United States, be prepared for that. And if you're teetering on the edge of, should I start a practice related to being fascia-informed and offering fascia targeting approaches, then now would be a good time to be thinking about that. Okay, so like I said, I had one lady who called and left me a message, and she was really sweet, and she said, "I think I have that fascia. I have that fascia in my legs, and I think that you can help me with my fascia." It was just really sweet, and I spoke to her, and she came in. She saw Maddie. I have not talked to Maddie to see how that session went, but she did end up signing up for a month's worth of my Fascia-Informed yoga, so that should be fun to have her there. Fascia offers a more complete view of the body and how we can support function and healing. In the Occupational Therapy Practitioner's Guide to Fascia-Informed Practice, I help you explore the powerful role of fascia in everyday client care. Through my live and online courses, you'll gain practical hands-on skills you can use right away. Explore fascia, integrate skills, transform care. Visit fasciainformed.com to learn more and start your journey today. Now, the other voicemail that I got about the same time as this woman with the fascia was a person that sounded very young. And she said that she had been referred by her physician for a tongue tie release and a frenectomy. And we are getting kind of a reputation in our community for being good with TMD issues, and but yeah, if it doesn't stand out to you, let me spell it out for you. Frenectomy. Ectomy means to cut. So we don't cut, right? That would be outside of the occupational therapy scope of practice. So I called her back the next day and I said, "Can you say again what your doctor referred you for?" And she said, "Yeah, a tongue tie release and a frenectomy." And I explained that a frenectomy means, ectomy means to cut that part of your body? And she said, yeah. And I said, okay, well, we don't do that. And I said, well, because of the tongue tie release, I said, we do that. Did you ever have somebody work in your mouth? And she said, oh yeah, I went to a PT who does that kind of stuff. And yeah, he worked on that and it didn't make any changes. And I said, did he work anywhere else in your body? I said that part of your anatomy from a fascial perspective connects down into the hips and even further down. I said, how would you characterize your posture? And she said, oh, terrible. My posture is just terrible. I said, okay. I said, well, you might want to think about approaching it from a whole body perspective and not just a super localized perspective. And I said, do you mind if I ask you why your physician has recommended a tongue tie release and a frenectomy? And she said, yeah, I chew through at least a couple mouth guards a month at night. And I just in my head, I just went, oh, honey. And I said, and can you tell me, I said, you sound very young. How old are you? And she said, 25. I said, okay. I said, when the person who worked in your mouth, did they work back in your cheeks? Did they work back inside your mouth where your teeth meet in the back? And she said, no, not at all. I said, okay. I said, well, the structures that your physician is suggesting that you release, I said, I think you might have, I said, I don't diagnose, but your symptoms are consistent with TMD. And she had never heard TMD. I said, temporomandibular joint dysfunction. She said, nope, never heard of it. I said, okay, open and close your mouth and feel the sides of your jaw where the hinge is. I said, press on there a little bit. And I said, is that tender? And she said, oh my gosh, yes, it's terrible. I said, you probably have TMD. I said, and I don't think those releases are going to stop you from clenching and grinding at night. I said, has anybody ever talked to you about sleep hygiene? Do you know what that means? She said, no. I said, has anybody ever talked to you about your getting ready to go to bed at night and things that you can do to calm your body down? Or has anybody ever talked to you about managing stress? Because often grinding is associated with high levels of stress. And she said, oh, no, nobody's ever talked to me about any of those things. I said, hearing about you have an issue yourself, saying yourself that you have very poor posture, you're not sleeping well, you're grinding through mouth guards. She said, oh yeah, I can't imagine the amount of plastic I have in my system because I chew it and then I end up swallowing it at night too. And I'm like, oh. I said, based on everything that you're telling me, your symptoms are consistent with TMD. I said, we work with clients with TMD, and maybe that's why your physician referred you to us as a step before the ectomy. And it sounds like the manual therapist that you work with did not work in the areas that really could be more helpful with something like TMD. And she said, okay, yeah, that makes sense to me. And she said, yeah, I would really like to try that before I actually have anything cut. And I said, yeah, cutting it's permanent. You really can't go back from that. So I said, trying to work towards something that's going to stop the grinding is probably going to net you the results that you're looking for. And I'm not saying you have to work with us. Let us come in and let us take a look. Let us educate you. We can teach you things you can do yourself to help yourself, so you're not reliant on us. And she said, oh, that would be great. And I said, we don't take insurance. You have to know that too. And she's like, well, that's okay. This sounds like it would be really helpful to me. And I said, okay, great. I would love to work with you And I think we can really help. So we scheduled her an appointment, and it was 2 days later, I got an email from her saying, I need to cancel my appointment. My mom wants me to go to the surgical consult first. And then if he decides, then I will come back and rebook my appointment with you guys. All I could do was just sort of hang my head and shake my head because, if you have a hammer, everything's a nail, right? A surgeon, that's not true all the time. If a surgeon's, there's so many different, my fear is, we'll just say what my fear is. My fear is the surgeon will say, oh yeah, it's not that big of a procedure. It's easy to do. And we'll just do it and see what happens. And then she's got that expense and something that's irreversible and probably no change in her nighttime grinding habits. So she's back to square one, even though she's had all this output and probably some pain. People that I've spoken to that have had the tongue tie release have said it's painful and it takes some time to recover from that as well. And I know I've probably talked about this before at some point, but many years ago, I went to my dentist, and it was kind of when people were starting to talk about tongue ties, and my dentist is looking around in my mouth, and he says, oh, you've got a tongue tie. We should go ahead and release that. And I said, no. Why? He said, well, it just looks really tight. I said, I'm not having any symptoms. Why would you do that? Well, it just looks tight. And I said, no, thank you. I don't want to do that. I have no interest in doing that. So it was just like handing them out like lollipops in that particular case. So anytime you cut something, you're going to end up with potential scarring. So you just have to be careful. Anyway, I wanted to share that story because, one, if you've got clients calling you, have a conversation with them. That does a couple things. It might help them solve a problem they didn't even know they had. It gets them more comfortable with you. It shows them that you care. And if you're asking the question like I did, you probably do care, right? It breaks my heart to hear about someone that young experiencing that much tension in their life, that they've developed a habit that severe that is creating problems for them. Yeah. To me, that's like, let's do the carpal tunnel surgery, but never teach the person about ergonomics. It's let's do the back surgery, but let's never look at posture. Let's never look at movement habits. I think there's a shift coming to look at more whole body, to look at the bigger picture. But when medicine is so specialized, it will always be a part of things. But the other thing I would encourage you to think about too is there's a lot of physicians and surgeons out there that really, of course, really do want to help their patients get better. And so knowing what you know, you can better educate them. And we actually, a couple years ago, Caitlin and I sent out a flyer to many of the local dentists saying, this is what we do, and here's why we do it, and here's how we can help you help your clients. And educating the physicians rather than thinking of it as marketing yourself to the clients, marketing yourself to physicians. You're educating, you're helping them better understand how you can help, better understand what's going on in their bodies in the case of clients. But anyway, I thought you might enjoy that story and get hopefully some tips to help you answer questions for your clients, and maybe hopefully embolden you to ask a few more questions about what's going on with them if they do call you. And are potentially looking for your services. So I'm putting it out there to the universe that this gal circles back and ends up with us, and the surgeon thinks perhaps she might try something conservative before something permanent. So thank you so much for listening as always, and I hope everybody has a really, really great day. You've been listening to the Fascia-Informed Therapist Podcast. Be sure to subscribe so you don't miss new episodes. And if you'd like to go deeper, check out my continuing education courses, both online and in person. You can find them at fasciainformed.com. Thanks for listening, and I look forward to next time.